morning. Today's class is on oral malodor, and the learning outcomes include describing the various causes of malodor, explain or list the various methods used to diagnose malodor, explain the various management and strategies used in addressing a patient with complaint of malodor. The contents include definition, importance, categories of halitosis, etiology, detection, treatment, and will finish it with conclusion. Halitosis is termed as fetor ex or fetor oris or breath malodor. It is a foul or offensive odor emanating from the oral cavity. Jane Linde, on the other hand, he has told that it is an unpleasant odor of the expired air, whatever may be the origin. Next, coming on to the categories of halitosis. So there are three different categories of halitosis. Genuine halitosis, it is a term which is used when the breath malodor really exists and can be diagnosed organoleptically or by the measurement of the responsible components. Pseudohalitosis, when an obvious breath malodor can be perceived but cannot be perceived, but the patient is convinced that he or she suffers from it, then it is termed as pseudomalodor. So as such, the patient doesn't have any agents leading to malodor, but she believes that she is suffering from malodor, then it is called as pseudohalitosis. Halitophobia is a recognized psychiatric condition where the patient fears having halitosis condition. So what could be the etiology for this? It could be of two types, either intraoral causes related to dentition, for example caries or food getting stuck or food impaction, or it could be because of periodontal infection, or it could be because of dry mouth, that is xerostomia, or it could be because of the tongue on the tongue coating. Extraoral causes because of diseases related to ear, nose and throat, bronchi and lungs, gastrointestinal tract conditions such as Zenker's diverticulum, gastric hernia and regurgitation, liver insufficiency, kidney insufficiency, systemic metabolic disorders such as diabetes mellitus, hormonal causes and medications. So mainly it has been found that the unpleasant smell of the breath originates from the volatile sulfur compounds. So this gives a characteristic smell of rotten eggs. This was first described by Tonashi. The three volatile sulfur compounds which gives rise to the malodor is hydrogen sulfide, methyl mercaptan and dimethyl sulfide. Other compounds are also present, which includes diamonds, indole, scatol, butyric or propionic acid, volatile fatty acids such as valerate, butyrate and propionate. Apart from this, when hormonal, gastrointestinal, renal or metabolic pathologies are the cause, additional malodors will also be produced. Halitosis due to local factors, which could be pathologic or non-pathologic. Halitosis due to systemic factor, which could be pathologic and non-pathologic again. So again, local factors and systemic factors are the key words here. So we will go about each of these to find out what are the factors which are present, and then if you realize or understand the factors, then your treatment plan can be directed towards reducing these factors. So coming on to halitosis due to local factors of pathologic origin. So it could be because of poor oral hygiene. You could see here calculus and plaque. So because of this, there could be an oral malodor. It could be because of extensive caries. It could be because of periodontitis, open contacts which lodges the food leading to food impaction, Vincent's disease, otherwise necrotizing ulcerative gingivitis, hairy coated tongue, fissured tongue, excessive smoking, healing extraction socket, necrotic tissue from ulceration, or dentigerous cyst with fistula draining into the cavity. So all this could lead to some amount of halitosis. So directly treating them can result in lesser amount of production of the malodor. Next, coming on to halitosis due to local factors of non-pathologic origin. So it could be because of the stagnation of saliva, especially morning breath is due to this reason. Morning bad breath is due to this reason. Odor intensity increases with age. Sometimes acrylic dentures do cause some smell resulting in denture breath. Endodontic patients who are on therapy may have a bad smell. It is because of the seepage of the eugenol or the fomacrosol. Next, coming on to the halitosis due to systemic factors of pathologic origin. So there are lots of smells which are present, which have been found by authors after sufficient studies, but these four terms which are highlighted are for you to remember. So if a patient is having a smell of rotten apples, then you could probably come to a conclusion that he has uncontrolled diabetes, so you have to send him for proper testing. So this is mainly because of the accumulation of the ketones. If the patient's smell has a smell of a dead mice, or it has a sweet odor, then the patient could probably have a liver insufficiency. If the patient has a smell of a fish odor or a malodor of fish odor, he could probably have a kidney insufficiency or uremia present. During fever, dehydration, or macroglobulinemia, you do have some amount of odor which is being produced. This is mainly because of the xerostomia with poor oral hygiene and accumulation of toxic waste products. Next, coming on to halitosis due to systemic factor of non-pathologic origin. So metabolites of ingested food excreted through the lungs. Excessive meat eaters, they do have malodor. This is mainly because it contains more protein and they are having more amount of protein diet. Garlic, onion, or alcohol if taken. Alcoholism plus liver cirrhosis could produce halitosis. Hunger periods, we generally do have bad smell when there is hunger present for a long time. This is mainly because of the putrefaction of the pancreatic juice in the stomach. Systemic administration of drugs like isosorbitol dinitrate, it is because of its end products. Ethyl alcohol, medications containing iodine like iodinated glycerol, it is because of the drug itself. And phenothiazines and its derivatives, it is because of the xerostomia caused by the phenothiazines. So because of all this, you do have a halitosis which are present. So you are supposed to find out why the halitosis is there, whether it is because of the local or systemic factor. So after coming to this conclusion, find out whether it's pathologic or non-pathologic, and then go towards your treatment accordingly. Now coming on to the physiology of malodor detection. So the perception of these molecules depends on the following factors: the odor itself, olfactory response, it can be pleasant, unpleasant, or even repulsive. So a specific concentration before it can be detected. How much is the threshold concentration which is present? The odor power is the extent of concentration, thus must be increased before a judge gives it a higher order score. The volatility of the compound and the substantivity. So all these are required to tell or detect a proper malodor. So mostly allow the patient to self-test themselves to detect the proper malodor. Mostly it is done by these four methods: smelling a metallic or a non-odorous plastic spoon after scraping the back of the tongue, smelling a toothpick after introducing it into the interdental areas, smelling saliva spit in a small cup or a spoon, or licking the wrist and allowing it to dry reflects the saliva contribution to the malodor. So from this, the patient will be able to realize that the smell is because of his own oral hygiene condition or related to local factors. So this has to be taught to the patient and explained to the patient. Next, coming on to organoleptic rating. This is another method to detect the malodor. So this is considered to be the gold standard in the examination of the breath malodor. A trained judge sniffs the expired air and assesses or not if this is unpleasant using an intensity scale. This is mainly dependent on the olfactory organs of this clinician. So this scores were given by Rosenberg et al., where he found that he had given a score 0 when there is no appreciable odor, 1 if there is barely noticeable odor, 2 if there is slight or noticeable odor, 3 if there is a moderate odor, 4 if there is a strong odor, 5 if there is an extremely foul odor. So once this perception is made, check out for the etiology and then go about for the treatment plan. Apart from this, you do have other agents which could detect the malodor, like for example gas chromatography of breath samples. So it is being found to be the most informative one. It is extremely sensitive and it is precise. So seeing its size only you can understand this is a little bit expensive and cumbersome, and it's limited only for the research centers. Apart from this, you do have the portable sulfide meter, or otherwise known as the haliometer. This can be used in the dental office. The patient is asked to blow through it and you can detect the volatile sulfur compounds. This must be calibrated regularly to maintain its accuracy. Other methods include the electronic nodes, otherwise known as the oral chroma, dark field or the phase contrast microscopy to detect the bacteria, and the salivary incubation test, again to detect the bacteria present involved. So, as I told you, there are three categories of halitosis before itself. Miyazaki has come about with the classification of halitosis with the corresponding treatment plans. So as I told you, genuine halitosis is one where there is an obvious malodor which is present. So this has been classified as physiologic and pathologic halitosis, which are intraoral and extraoral causes. So physiologic halitosis could be because of the putrefactive process of within the oral cavity, or it could be because of the dorso-posterior region of the tongue coatings, or it could be because of temporary halitosis due to dietary factors like garlic. So in these conditions, just treatment category 1 is sufficient, so which corresponds to explanation of the halitosis and instructions for oral hygiene. So this gains support and reinforcements of patient's own self-care for further improvement of the oral hygiene. Whereas the second category is pathologic halitosis, which has oral and extraoral categories. So oral categories where halitosis could be caused by a disease, a pathologic condition, or a malfunction of the oral tissues. It could be from the tongue coating or modified by conditions such as periodontal disease or xerostomia. So in this case, you could include the treatment category 2 along with one where oral prophylaxis, professional cleaning, and treatment for the gum diseases, especially periodontal disease, would be required. The third is your extraoral pathologic halitosis, which includes TN3 category also, where a malodor comes from a lot of extraoral causes, as we had discussed before, that is ear, nose and throat, GIT related, lung related. So for this, along with the treatment 1 category, treatment 3 category, that is referral to the physician or medical specialist, is required. The next one is your pseudohalitosis. So as I told you, the obvious malodor is not perceived by the others, but the patient believes that he is having breath malodor. So for this, proper counseling is required and simple oral hygiene measures. And along with this, explanation of the examination data, further professional instruction, education and reassurance is required. Halitophobia. After treatment for genuine halitosis or pseudohalitosis also, the patient still believes that he is having halitosis. So for, no physical or social evidence exists to prove that he is having halitosis. For these conditions, along with TN category 1, TN category 5, where a referral to a psychologist, psychiatrist or other psychological specialist is required. So all through these procedures, all through these treatments, TN category 1 is to be implemented along with the other treatment needs. Now coming on to the treatment, so we go through treating the malodor with the help of 4 different strategies. So first is mechanical reduction of the intraoral nutrients and microorganisms, chemical reduction of the oral microbial load, rendering the oral malodorous gases non-volatile, masking the malodor. Okay, coming on to the mechanical reduction of intraoral nutrients and microorganisms. So first one here is that tongue cleaning is very much required. This reduces the amount of coating, that is a nutrient, bacterial nutrients, as well as the number of microorganisms present. So this could be done either with the help of brush or the tongue scrapers. Interdental cleaning and toothbrushing, this forms a mechanical means of dental plaque control. So this has to be reinforced to the person to the patients correctly. Tongue cleaning, interdental cleaning, as well as toothbrushing. A 1-stage full mouth disinfection using scaling and root planing, And chlorhexidine, application of chlorhexidine is done to reduce the organoleptic levels up to 90%, especially in patients having periodontal infections. Chewing gums may control the bad breath temporarily because it can stimulate the salivary. Next, coming on to the chemical reduction of the oral microbial load. So this is mainly done with the help of oral rinses, where they have found to have antimicrobial agents such as chlorhexidine, cetylpyridium chloride, essential oils, chlorine dioxide, hydrogen peroxide and triclosan, but they have only a temporary reducing effect on the total number of microorganisms in the oral cavity. Rendering the non-volatile rendering the malodorous gases non-volatile, that is conversion of these volatile sulfide compounds into non-volatile ones. So this can help in reducing the malodor. So this can be done with the help of metal salts. So zinc contains a double positive charge. This binds with sulfur radicals having double negative charge, and this can reduce the expression of the volatile sulfur compounds. Toothpaste such as containing baking soda can have bactericidal effect, as well as it can have transform the volatile sulfide compound to a non-volatile state. Chewing gums with fluoride and chlorhexidine can also convert the volatile sulfide compounds to a non-volatile state. Last one is the masking of the malodor. This can be done with the help of rinses, mouth sprays, mint containing lozenges containing volatiles with pleasant odor. Chewing gums or increasing the fluid intake can also be done to mask the malodor. Chewing gums acts by lowering the pH of the saliva, which increases the solubility of the volatile sulfur compounds, or they simply increase the secretion of the saliva. So orange juice all has been found to mask the odor, malodor especially. So coming on to the conclusion, so breath malodor has important socioeconomic consequences and can reveal important diseases. A proper diagnosis and determination of etiology allows initiation of proper etiologic treatment. Clinician can either do a trial therapy to deal quickly with intraoral causes, like for example full one stage disinfection, including the use of proper mouth rinses and toothpaste, or a multidisciplinary consultation. Thank you.